Yes, you're all welcome to this channel, and it's my pleasure that you have clicked on this video. So today we're going to talk about paracetamol, which is also known as acetaminophen, and most people know it as panadol. So let's see, how does paracetamol work? How do we take it throughout our body? How does it affect our body? What should I consider before taking it, and what are the importances of paracetamol? So first, let's talk about the routes of administration. Routes of administration, this is through which the drug is introduced to the body. The first route is the oral route. Oral means mouth, so through the mouth. Through the mouth we have two forms. We have syrups and we have tablets. The tablets are most times in a form of 500 milligrams. Then second is the rectal route. This is through the anal canal, whereby we use the suppositories. Then the third route is the intravenous route. This is not mostly used in many countries, but where it is used, it is most times used at the emergency department or in emergencies. So let's talk about the pharmacokinetics, and here we are going to talk about the movement of the drug within the body. How does the drug move through the body? And when we talk about the pharmacokinetics, we have to talk about 4 stages. First stage is absorption. Second stage is distribution. Third is metabolism, and fourth is excretion. So first, let's talk about absorption. Absorption is done through the gastrointestinal tract, and the peak plasma concentrations occur about 10 to 60 minutes after oral administration. What do we mean by peak plasma concentration? Peak plasma concentration means the highest level, at the time at which the highest level of the drug is found within the body. So the drug, at what time will it be in high concentrations within the body? That is from 10 to 60 minutes. Then distribution, it is rapidly and evenly distributed throughout most of the tissues in the body. So most times the drug is bound to red blood cells. Plasma binding is negligible at usual therapeutic doses, but increases with increasing doses. So the higher the dose, the higher the distribution. But here they are telling us that paracetamol is distributed throughout the whole body. And then third, let's talk about metabolism. Predominantly, it is done within the liver. So metabolism most times takes place within the liver. And the major metabolites we get are the sulfur and the gluculanoid conjugates. These are got the sulfate and the gluculanoid conjugates are got after the endogenous and exogenous metabolism of compounds. So after metabolizing endogenous and exogenous compounds, we shall get the sulfate and the gluculanoid conjugates. So lastly, we talk about the excretion. 95% of paracetamol is excreted throughout urine, and the 5% which is excreted while unchanged, less than 5%. Then let's talk about the pharmacodynamics, effects of the drug and the mechanism of action. So here we are talking about the mechanism of the drug. Paracetamol is a derivative of p-aminophenol. P-aminophenol can be also called para-aminophenol, or it can also be called 4-aminophenol. So which exhibits analgesic and antipyretic activities. Though the mechanism of action is not well known as other NSAIDs. Paracetamol does not appear to inhibit the function of the cyclooxygenase enzyme outside the central nervous system. So what do we mean? It means it affects the cyclooxygenase enzyme only within the central nervous system, and this appears to be the reason why it is not useful as an anti-inflammatory. So if you want to understand more of this statement, you will go and read more about the cyclooxygenase enzyme. Then it does appear to selectively inhibit the cyclooxygenase enzymes activities only in the brain, which may contribute to its ability to treat fever and pain, thus not contributing to the anti-inflammatory effect. Then lastly is the antipyretic effect. So remember we are talking about the pharmacodynamics, mechanism of action. How does it cause the antipyretic effect? It is through action on the hypothalamic heat regulating center, which is found in the hypothalamus. Remember we said it works only on the central nervous system. So that's how it can cause the two effects, the analgesic effect and the antipyretic effect. Then let's talk about the indications. The indications, we are talking about the uses, the benefits. So the indications or the uses will depend on the classes of the drug. That is the analgesic class and the antipyretic class. Let's first talk about the analgesic use. How does it help in relieving pain? So which conditions mostly does it help on? We are saying here paracetamol relieves mild and moderate pain like headache, toothache, lower back pain, dysmenorrhea. Dysmenorrhea means painful menstruation. Then and others, and many others. Then the antipyretic effect, it is used in reducing fevers in all people of all ages, and it is also used in post-immunization fever, because after immunizing these children, most times they get some fever. It's the one we call the post-immunization fever. Let's talk about the dosage. After seeing the the indications that we are going to treat headache, toothache, dysmenorrhea and others, how shall we dispense it? Remember, we are managing mild to moderate pain. So adults, we are going to give. So adults in medicine, we are talking about people who are above 12 years. According to the severity of the pain, we shall give 0.5 to 1 gram every 4 to 6 hours, and we don't exceed 4 grams. So when I talk about 0.5 grams, I talk about 500 milligrams. When I talk about 1 gram, I talk about 1000 milligrams. So that is for the case of children. For the case of adults, we don't exceed 4 milligrams. Then children of 6 to 12 years, we shall give 250 to 500 milligrams every 4 to 6 hours. Then children 1 to 5 years, we give 125 to 250 milligrams every 4 to 6 hours. So if the tab is 500 milligrams, meaning we shall give a quarter to a half every 4 to 6 hours. Then with children below 3 months to 1 year, we give 60 to 125 milligrams every 4 to 6 hours. Then children below 3 months, we shall give them 10 milligrams per kg body weight. So when you're talking about 10 milligrams per kg body weight, meaning you have to measure the weight of this baby. If the baby after weighing is like 3 kilograms, you will get 10 times the kilograms, which is 3. So that you will multiply 10 times 3, and that means you'll give 10 milligrams. Then note, do not take more than 4 doses within 24 hours. So meaning it is not beyond HYD. Then use suppositories in children who cannot swallow, and the dose is the same as oral paracetamol. So that is how we give paracetamol, that is the dose. Then after taking paracetamol, let's talk about the side effects, the adverse effects. These may happen or they may not happen. First, let's talk about the rash. Second, dizziness. Then third is angioedema. These are the painless swellings under the skin. So most times angioedema is triggered by an allergen. Then we talk about thrombocytopenia. This term means reduced platelets, reduced levels of platelets within the body. Then leukopenia, which means reduced white blood cells within the body. Then we talk about neutropenia, reduced neutrophils within the body. So most times in medicine, where you see the word penia, it means reduced. Then lastly, there is liver damage following an overdose. So if you take much of paracetamol, it will cause liver damage. Contraindications. Where should we give with caution? So where should someone say, is it really necessary to give paracetamol or not? So those are the contraindications. First, patients with known hypersensitivity to paracetamol. So patients with known hypersensitivity, we mean those who are allergic to paracetamol. Then 2, severe liver disease. So patients, remember we said an overdose of paracetamol causes liver damage. So already someone has a liver problem, and again you're adding a drug which will add on, which will also cause a liver problem. So you're worsening the condition. Then patients with alcohol dependence. Remember, these people with people who are dependent on alcohol, they are more likely to get liver diseases. So when you also give paracetamol, which also causes liver diseases, it means you're adding a problem on a problem. Then refer to the drug interactions for additional information. So we are going to see the drug interactions in front there. Then note, paracetamol can be used and it's safe for both pregnant and lactating mothers. Meaning, if the mother is pregnant or is breastfeeding but has some pain, you can give paracetamol, or has fevers, you can give paracetamol. Then let's talk about the precautions. Precautions will mean before giving out paracetamol, what you should be knowing. That patients with impaired hepatic function, we give with caution. Then patients with impaired renal function, hepatic we refer to the liver, then renal we refer to the kidney. Meaning patients with impaired liver function, we give them with caution. Then patients with impaired kidney function, remember metabolism takes place within the liver, meaning if there is any problem with the liver, metabolism will not be adequate. Excretion takes place within the kidneys, meaning if there is anything wrong with the kidneys, excretion may not be done adequately. Then we talk about the drug interactions. These are some of the interactions I got. First is the anticoagulant drugs. Dosage may require reduction if paracetamol anticoagulants are taken for a prolonged period of time. So anticoagulants, we are talking about like warfarin. Where you feel there is a term you have not understood, You can refer to research about the term so that you understand very well. Then 2, paracetamol absorption is increased by substances that increase gastric emptying like metoclopramide, mostly known as pasil. Meaning our absorption will be high because there is a drug which is taken which increases gastric emptying. Gastric emptying, we mean the stomach. Meaning if the stomach is emptied quickly, the drug is also being emptied quickly. Then paracetamol absorption is also decreased by substances that decrease the gastric emptying, e.g. antidepressants. Antidepressants, we are talking about drugs which patients with depression are given so that their mood at least is switched on. So paracetamol, this decrease the drug absorption, and why they also decrease the gastric emptying. So the drug absorption will also be decreased. Then paracetamol may increase chlorphenical concentrations. So meaning we give with caution. You know, I'm giving this dose of chlorphenical, but the concentrations will increase. Then the risk of paracetamol toxicity may be increased in patients receiving other potentially hypertoxic drugs or drugs that increase liver microsomal enzymes such as alcohol. We talked about it. Alcohol dependent patients, we give with caution because alcohol is toxic to the liver. And again, you're adding a drug which is also likely, if taken in high doses for a long period of time, it's also likely to be toxic, meaning you're adding a problem on a problem. Then paracetamol excretion may be affected by the plasma concentrations altered when given with probenecide. So probenecide is a drug used to treat people with gout. So when do we give this? It's when like you have a patient with decreased output of uric acid in the body. So probenecide is given to increase the uric excretion in urine, uric acid excretion. Then lastly is the cholestyramine. Reduces the absorption of paracetamol if given within 1 hour of paracetamol. This is a drug which is used to prevent reabsorption of bile. So meaning it is given to increase on the excretion of bile within the body. So if there is a person with a problem with bile reabsorption, maybe like if it is increased, there is increased bile reabsorption, we shall give that cholestyramine. So if given with paracetamol, within the same time there would be decreased absorption. So you have to space them with a period of 1 hour. So let's talk about your patient's instructions. What should a patient put in mind? Take paracetamol only as long as pain lasts. Avoid prolonged use. If they gave you paracetamol for 3 days, 5 days, and the pain goes within 2 days, stop the paracetamol. Or when the fevers stop, or they have reduced. So when the fevers stop, you stop it. When the pain stops, you also stop the drug to avoid prolonged use. Then second, do not exceed 2 doses if used in post-immunization fever. Remember we said paracetamol treats post-immunization fever. If you see you've given 2 doses and the patient is not improving, bring the child back to the health facility if the fevers persist. Then next is wiping the child with a full sponge. This also helps in reducing the temperature. We call this rapid sponging. So as the temperature is high, you're giving paracetamol, you can also rapid sponge the baby. Then lastly, we are talking about the nursing considerations. nursing considerations. What should a nurse have in mind when giving this treatment? To check the patient if he's not taking any other medications containing paracetamol, because there are many drugs that have been combined with paracetamol with other active ingredients. So when you give with this, it means the dose is becoming high, so there will be a risk of liver toxicity. Then for children who may refuse the medication of the spoon, try using medical syringes. So you get this syringe, squeeze the liquid slowly into the child's mouth, or use soluble paracetamol. Then give the drug with the food if there is gaiety, upset, if someone has some stomach problems, give with food. Then lastly, stop the drug if hypersensitivity reactions, meaning people who are allergic to paracetamol should not be given paracetamol. Then thanks for listening. If it has been beneficial, please subscribe, share and like. Thanks for watching. Share it with other people so that it helps them. Thank you.